I am tearing up.
I just about screamed right now, and I'm not even there.
Now that's inspirational, Natalie. I feel inspired today.
Part two of this.
I could be here for another hour.
And then I was top of my class. There were only two of us, and the other guy was in the hospital. So here I am.
And I always go, he winds up homeless on the street. It's my fault.
Yeah, now you sound like my wife.
And you can get off.
I don't know. Call it Google. Or call it Google.
Yeah. Control. Alexa, how does he get across?
Paul, I cut you off earlier. What were you going to say?
What?
Dang it! Don't do that to me, Paul. Don't do that to me, man.
I don't know what got into my head, but I thought this thought, if I'm working year round, I might as well get paid year round.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcasts, Spotify, and SoundCloud, and subscribe today. Now, it's time to get started with Sweet Talk.
Hi, everyone. Welcome to Sweet Talk, our weekly podcast here at Idaho State University Continuing Education Workforce Training. And as always, I have my co-host, Gary Salazar, our director of our department, here with me today. Gary, how are you doing today?
Thank you, Paul. I'm doing wonderful. Every time you do that introduction makes me feel like I should be at the ballpark or something. That's just awesome how you come on like this.
I've been working on that radio voice.
You're getting better at it, man. That's awesome.
Well,
yeah, I'm doing fine. Thank you very much.
Sadly, Jason no longer is on the podcast, and so I've been trying to up my game on being the kind of introductory person. It's a beautiful day today. If for anyone who's listening, we are recording this on a Friday morning, and it's a nice, beautiful Friday morning, and we're all looking forward to the weekend.
Oh yeah, you bet. And it's been raining so much out here. I got grass to cut, so unfortunately, it won't be raining this weekend, and I'm going to have to work. But I'm looking forward to getting it back in shape.
All right. Hey, Gary, we have a special guest with us today. Is that correct?
We do. We're going to reach into the College of Technology and pull on one of our distinguished faculty, and I believe a director. His name is he goes by Johnny. Is Eugene Demekhin. Welcome, Johnny. I hope I said that right, and please correct me. All right. He's going to be our guest today, Paul. We'll be talking a little bit about a subject that I know very little about. It's a program that he leads. It's called Respiratory Therapy. So I'm keenly interested to learn more about this. Johnny, welcome. I appreciate you making the time to be with us today. It's nice to have you with us. I want to make sure I've got this correct. You are the Director of Clinical Education for Respiratory Therapy.
Program director.
You're the program director. Thank you for Respiratory Therapy, Health Occupations Department, College of Technology, Idaho State University, and that's a mouthful. If I got all that right?
Yes, you have.
Awesome. Welcome, Johnny. To get started, we always like to learn a little bit about our guests. If you wouldn't mind sharing a little bit about your background, and how you got to Idaho State University.
Sure. Well, first off, I want to thank you all for having me.
Thank you.
Well, a little bit about me. I'll just say where I was born. I was born in Ukraine. Came to America in 1995. I was raised in San Diego, California. I graduated from Rancho Bernardo High School. I went to California College of San Diego, which is a college in San Diego. After I got my associate's degree, I passed I got it in the respiratory therapy. I passed my board exams. I became a tutor at first within that college. Then I became a tutor at Stevens Henniger College, then started teaching there. After that, I moved on to Salt Lake Community College and continued teaching there, as well as being the clinical director of respiratory therapy there. As I was working there, I was also working at St. Joseph Villa, which is a small facility, skilled nursing facility in Salt Lake City, Utah. as well as Promise Hospital, which pretty much extracted itself from the LDS hospital that was there, which was a big hospital, into a smaller one. And then I came here as an anatomy and physiology instructor at ISU. Later, I find out that they needed some help in the respiratory therapy program. So I have my RRT credential, which qualified me to be the interim program director. Then I became the interim clinical director after that. And then I went back to program director, except I'm permanent now. So
that's quite a journey. And that's a lot of experience under your belt. And you went to school in San Diego, or that's where you grew up in after coming across from Ukraine? Awesome. So how long have you been here in our United States?
So, well, I moved here when I was 3 years old. I'm 29.
Okay.
So.
All right. Very cool. Well, it's nice to have you on board, and I'm glad you're here at Idaho State University, and you're working with Dr. Henry O. Is that correct?
Correct.
Okay, because we've had Henry O on a podcast before, haven't we, Paul?
Yes. Actually, Henry is very impressed with you. He came to us and suggested you as a guest. So Henry thinks you're a great guy.
Thank you.
So yes, I know. And he won some kind of an award, Paul. I think.
Yeah.
Johnny, you won an award recently, didn't you?
I did win an award. I got Teacher of Honor award by Kappa Delta Phi, which is a international organization, at the beginning of 2022. And another accomplishment just recent was that I got appointed as vice president for the Utah State Society of American Medical Technologists.
Oh, wow.
Wow. That sounds very, very
Those are
impressive.
some nice credentials.
Yep.
Hey, just for me being a layman, can you just explain what respiratory therapy is?
Of course. So not a lot of people know about respiratory therapy. Everyone knows about, nursing, CNA, PTA, OTA. So respiratory therapy hasn't had its light shined on until the COVID-19 pandemic hit. And now a lot of people know more about RT. So what we mainly do in the hospital, we focus on the cardiopulmonary system, so the heart and the lungs, as well as the airway leading to the lungs. So patients that cannot breathe or they're unconscious, not breathing, we instill artificial airways, and we can simulate the breathing for them using a mechanical ventilator.
So a mechanical ventilator, is that like something that goes through the tube and it's just set up, it just automatically pushes the air in and out?
That's right. Put them on cruise control and they go.
I'm glad they have cruise control if they're unconscious. But do you do that also for people who are conscious if they need help breathing?
Yes. They can be awake throughout pretty much well, they're not going to be awake through the procedure. They're going to be sedated and paralyzed. But when they wake up from it, it's not a very comfortable situation, but patients normally don't stay on the vent more than a few weeks unless they are really downgrading, especially with COVID. Some of them don't make it, unfortunately. But usually the turnaround is within those couple weeks where they can get extubated and, taken off that support.
Yeah, I mean, you are correct that we have got a much brighter light shined upon people who do, help with ventilation over the last couple of years. In fact, I can't imagine any news story about COVID which they didn't talk about ventilating people and the shortage of ventilations. I would imagine that meant a shortage of respiratory therapists as well.
It's actually pretty scary because there was a story on the East Coast where, not everyone knew how to use a ventilator and, not enough staff for so many patients that, you had some medical professions outside of respiratory just pushing buttons trying to figure out the ventilator. And if you put too much pressure into the lungs, they can pop.
Oh,
It's dangerous if you don't know what you're doing.
Oh yeah, I hadn't thought about that, but you probably in that role would have to deal with a variety of different kinds of people, young people, kids,
That's right,
elderly people. You got to be really careful with that. So your training takes you through that, how to properly, I'm assuming how to properly administer the airflow if you're a child, and otherwise if you're an elderly person or just like a triathlete. When you do that, I mean, how do you gauge how much air to put into somebody or how to make that machine work properly?
Well, we have our standards, which have evolved throughout the years. They've changed significantly. I can go into the details. Basically, back in the day, we used to use a standard of 10 to 12 mLs of tidal volume for adults, at least, for example. But then we've noticed that they've become over distended. We don't want to cause pulmonary barotrauma anymore, so we've had to lower that range with those numbers. So now we're using 6 to 8, which is much lower than 10 to 12, unless you have someone morbidly obese, but then again, it was all through trial and error. Not everybody really knew the effects until they had to, pretty much do the research and see for themselves. You can't really, it's hard to, do this on a mouse.
Right, right. So I imagine COVID brought a lot of the past experience and the work in the field has brought that to light. Has COVID changed some of the processes or procedures that are now being used today?
Yes, because most RTs kind of went straight to intubation and putting them on a mechanical ventilator. But with the pandemic, the way this virus worked, it almost seemed like it was a death sentence putting them on the ventilator, which is a lot different than, say, a patient that's gotten a drug overdose and is unconscious. Nothing's wrong with the lungs. They're just, but with the narcotics, maybe just depressed and put the lungs to sleep, essentially. So that's much easier to manage than COVID, where you have just this acute respiratory distress syndrome where the lungs are stiffening, getting harder, and you're needing to put more pressure into it to ventilate. And then when you put too much pressure, that's going to mess with the heart. So then you have cardiac output decreasing, blood pressure decreasing, all these hemodynamic factors, and you're just balancing what you can.
So these are the things that you're teaching in your program for your
Yes.
respiratory therapy students. They come in and this is what they're learning. Could you tell us a little bit about, some of the topics that they have to pick up, some of the classes they have?
Of course. So they have patient assessment. They have intro to respiratory care. They both have labs for each class. We have the ventilator class, critical care management, pharmacology is very important. And then they also have a board review class for the board exams, the 2 board exams that they would have to take after the 2-year program. More than 700 hours of clinicals are required. We have 9 clinical sites, 3 of the big hospitals. We have St. Luke's, Ermac, and Portneuf Medical Center. And so it's like a big interview for them during their experience there. They're in the code blues, they're drawing blood from the radial artery, doing EKGs, checking out chest x-rays. A lot is involved with this program, and it's pretty demanding, but so is a lot of medical oriented programs.
That's a lot of hours.
Yeah.
Goodness.
So when someone goes into this field, are they, are they working in mostly a hospital environment, or are they working mostly in a trauma environment?
Oh, they have a lot of options. They can work in the hospital. They can work in a clinic, a skilled nursing facility. They can work on the Life Flight helicopter. They can travel if they get the highest credential, because there's 2 exams. You pass the second board exam, you get the RRT. You can go to any state or any country that offers respiratory therapy. Of course, it's sad, but my birth country doesn't even have respiratory therapy. So if you got those COPDers, they're out of luck, you know. But yeah, you can work in home care. You can work in a sleep lab.
Oh,
PFT.
so it's a wide. I mean, I guess anytime that you need to help a person breathe.
Yes.
So any environment.
You don't have to work in the ER or the ICU if you don't want to, although you get the best experience from there, essentially.
So if I understand correctly, going back to the 7 hour, you said 700 hours plus of clinicals. This is in addition to coming to the classes, correct?
Correct.
All right. So what they learn in class is the theory and the practice in maybe your classroom labs, and then they go to a clinical site, one of those sites you mentioned, and they have to put in hours there working with other respiratory therapists and doctors. Is that right?
Correct. They
Oh,
do
goodness.
12-hour shifts. So basically the way it works, each semester they have 1 to 2 classes plus their clinical shift once a week. And so they follow around an RT. They have to get in there at 6 a.m. or 6 p.m. if they're doing the night shift. And they get report, do their 3 rounds, give report, and then they're good to go. So
okay, so that's great experience for the comment. And then when they're all done with that, then they have to take a couple of final exams, but also a board. They have to go with a board. What's the board?
It sounds a little scary because it is, 3 hours long, 160 questions for the first one, the therapist multiple choice exam. 20 of those questions are experimental. No one knows what they're going to be about, and whether you get them right or wrong, you won't even know. So you're really graded out of 140 questions, and you're trying to score above a 91. If you do score below a 91, but in the 86 to 91 region, then you can already apply for your license and you can start working, but you won't be able to work in all the states, especially California or New York, which pays higher. So you may want to get the higher credential and pass the with a high cut score of 92. Now, if you pass the high cut score with the 92, then you can be eligible to take the clinical simulation exam, which is 22 simulations, but this is not going to be A, B, C, or D anymore. This is going to be up to 6 or 8 options to click from with 2 correct answers. And it's out of this bank of points. If the board likes you, they'll give you an exam with plenty of points that you can make it, like the 500 points. But if they don't like you, they can give you an exam that's worth under 300 points, which means you got no room for error. I mean, you have some room for error, but you're going to be scared a little bit more. But I have practice exams, 3 versions of both of those types of exams that are even harder than the real ones. So if they can pass my hard exams, then it's almost a guarantee that I say almost.
So you have a way of helping them prep for the exam then?
Yes.
Oh, that's
the final class. They will get so many of these practice exams. I just throw thousands of questions at them, and I've had a 100% passing rate.
Whoa, that's awesome! 100% passing rate. Yeah,
wow, excellent,
very, very
excellent.
Yeah. So I mean, this sounds very, very challenging as a class, but obviously it's very well needed. You want people certainly very experienced and qualified. Johnny, in your experience, what kind of students make the best respiratory therapists?
I noticed we get a lot of students from the CNA background. I have students that were on wait lists for other programs with high GPAs, and maybe those programs are just too full, and the time keeps rolling by, and those students look into respiratory therapy as almost a backup, but then they realize, well, if I had known about respiratory therapy, then they would have, if they had known, they would have already went there first. But students that care, it's not about money. The money is going to be there regardless. The salary actually has picked up $10,000 more than the past years because of the pandemic. And students are interested in saving lives without having to go to school for so many years. You know, I mean, 2 years is, I'd say, a pretty good deal. You know, we will offer a bachelor's program as well. It's starting in the fall, the BSRT, but you know, that's an option.
Right, right.
I actually, for another video that I was doing for the College of Technology, I actually interviewed one of your students who had received a scholarship, Zach, and his story was very poignant. The reason why he got into the program, he had a personal story about a friend that he knew that had breathing issues, and he was very interested in getting into respiratory therapy.
Yes, a lot of students also have that story as well. They have family members with COPD, or, you know, COVID-19 really affected their lungs where they're just not feeling the same anymore with their breathing. Zach actually, he surprised me. He took a practice exam, a practice board exam online. And keep in mind, he's only finished the second semester, got over 100. He scored over 100.
Wow.
Very, very good.
Yeah, he seemed very committed when I talked to him.
Yeah. Hey, Johnny, we're closing out. Our timer went off, but we do want to give you a chance to respond to this question. If somebody wanted to get more information on your program, or they wanted to talk with you, is there a good way for them to reach out and contact you, or what would you recommend?
You can email me. My email address is demeeuge@isu.edu, or you could just put my name, Gene Demekhin, at isu.edu, or you can call my cell phone number. I really don't mind. This is my passion. It's 760-822-3131.
Awesome. Thank you for sharing that.
Yeah, that's good. You know, Paul, our time has come to a close here, and so we're gonna have to say goodbye to our.
I know. I had more questions for Johnny, but maybe we can have you on again. So I really thank you so much for joining us today. I really appreciate it.
Yeah, Johnny, as the program director for respiratory therapy in the College of Technology at Idaho State University in the health occupation programs. Thank you so much. For those of you who've been listening and watching today, you know, this is an amazing career. It looks like it's doing very well out there, good salary, you know, a good way to get into it. It's open for caring people. Johnny's got an amazing program. He's got 100% success rate there with his students. So if you're looking for this is the place to come. You know, reach out to Johnny or us, and we'll get you in touch with him. This is a wonderful opportunity to listen to another difference maker in our community. Paul, you want to go ahead and close this up?
Yeah, I'm gonna give the same bat channel, same bat time thing here. So if anyone wants to contact us at our department, you can email us at cetrain@isu.edu, or you can visit our website at cetrain.isu.edu. Call us the old-fashioned way, 208-282-3372. And if you like this podcast, please like, subscribe, share. Gary, it's always a pleasure doing this with you. And again, Johnny, so much. Thank you so much for being with us today.
Excellent, Johnny. Thank you. Everybody, you be safe out there.